Okay, guys, we're going to discuss for show C tonight. We're discussing how chronic conditions um, connect to each other for everybody's health conditions. So here we go for C. Please join me in tonight's discussion. C, chronic condition connections. Okay. The article examines how multiple chronic conditions such as cardiovascular disease, kidney dysfunction, and metabolic disorders like diabetes interact and contribute to heart failure in older adults. The study, led by researchers from uh, Gentendo University, Graduate School of Medicine in Japan, focuses on patients aged 65 and older, a demographic often overlooked in clinical research. The researchers analyzed data from 1,113 hospital, hospitalized heart failure patients, categorized from uh, them based on whether they had none, one, or multiple overlapping conditions. They found that nearly half of the patients had two or three overlapping conditions, which significantly impacted their physical function and increased their risk of death. Okay. Rehospitalizations within 2 years, standardized tests such as walking speed and the ability to raise from a chair showed that patients with multiple conditions perform, performed worse than those with fewer conditions. The study highlights the importance of early identification and intervention for older adults with heart failure, offering offering a cost-effective method for risk assessment without requiring advanced diagnostics. If you're interested in the full article details, you can read more here, msn.com, guys. Okay. Several chronic conditions can lead to heart failure by either damaging the heart of or making it work too hard. Some of the most common contributors include, give me 2 seconds. Okay, third page. Coronary artery disease, or CAD, the narrowing of arteries due to plaque buildup, reduces blood flow to the heart, increasing the risk of heart failure. Okay, high blood pressure, hypertension. Over time, elevated blood pressure forces the heart to work harder, leading to thickened heart muscles and eventual failure. Diabetes. This condition increases the risk of heart disease and can contribute to heart failure by damaging blood vessels and nerves that control the heart. Heart valve disease. When heart valves don't function properly, the heart has to exert extra effort to pump blood, which can lead to failure. Okay, cardiomyopathy diseases that affect the heart muscle, such as dilated or, hold on, let's switch paper. Hypertrophic cardiomyopathy weaken the heart's ability to pump blood effectively. Obesity, excess weight puts additional strain on the heart and often linked to other risk factors like hypertension and diabetes. Kidney disease, impaired kidney function can lead to fluid retention and increased blood pressure, both of which contribute to heart failure. Okay, managing these conditions through lifestyle changes and medical treatment can significantly reduce the risk of heart failure. Okay, if you'd like more details on prevention strategies, let me know. Okay, coronary artery disease, or CAD, is a condition where the arteries that supply blood to the heart become narrowed or blocked due to the buildup of plaque. Hold on. A mixture of fat, cholesterol, calcium, and other substances. This process, called arteriosclerosis, reduces blood flow to the heart muscle, which can lead to chest pain, angina, shortness of breath, or even heart disease. Okay. And then you can find more about this at cdc.gov/heart disease about coronary artery disease. Causes of CAD. CAD develops over time due to various factors, including high cholesterol. Excess LDL cholesterol contributes to plaque formation. Okay, high blood pressure puts extra strain on artery walls, making them more susceptible to damage. Smoking damages blood vessels and accelerates plaque buildup. Okay, diabetes increases the risk of artery damage and inflammation. Obesity and sedentary lifestyle lead to conditions like high blood pressure and diabetes, increasing CAD risk. Symptoms. Okay, many people don't experience symptoms until the disease has progressed significantly. Common signs include chest pain or discomfort, angina, often triggered by physical exertion or stress, shortness of breath due to reduced oxygen supply to the heart, fatigue. The heart struggles to pump efficiently. Heart attack. A complete blockage can cause severe chest pain, nausea, sweating, and dizziness. Heart disease. Okay, then you can get the rest of the information here. CDC. Okay, cdc.gov, heart disease, about coronary artery disease. Okay, then we'll go down to diagnosis and treatment. Doctors diagnose CAD using tests like electrocardiograms or ECGs, stress tests, coronary angiography, and CT scans. Heart disease, CDC, www.cdc.gov, heart disease, about coronary artery disease. Treatment options include lifestyle changes, healthy diet, regular exercise, quitting smoking, medications to lower cholesterol, blood pressure, and prevent blood clots. Basically, blood thinners, guys. Okay. Procedures: angioplasty, stent placement. Stents are plastic stents are inserted into arteries to keep them open, folks. Okay, or the other option is bypass surgery to restore blood flow. Okay, now people can have like 2, 3, one bypass done, 2 or 3 done, and then stents are put in to keep them open. Okay, so and just for everybody's FYI. Okay, managing risk factors early can help prevent CAD and improve heart health. Let me know if you'd like more details on prevention strategies. Okay, there have been several advancements in the treatment of coronary artery disease, focusing on personalized medicine, minimally invasive procedures, and AI-driven diagnostics. Here are some of the latest developments. Okay, heart scans for personalized treatment. Myocardial infarctions, imaging MPIs is being used to tailor medication prescriptions based on imaging findings. A recent study found that patients prescribed ACE inhibitors or ARBs after MPI had significantly lower mortality rates. AI-assisted blood clot detection. Researchers at the University of Tokyo have developed a AI-powered microscope that can monitor platelet activity in real time, helping doctors assess clotting risk and adjust antiplatelet treatment accordingly. Okay, improved risk protection models. Scientists have created a machine learning model that integrates genetic, medical history, and lifestyle factors to predict CAD risk more accurately. This approach could lead to earlier interventions and better prevention strategies. Minimally invasive procedures, endovascular thrombectomy, a technique used to remove stroke-causing clots, is now being explored for severe CAD cases. This method restores blood flow without requiring open heart surgery. Okay, off-pump coronary bypass surgery. A beating heart coronary procedure was successfully performed on a 93-year-old patient, avoiding the use of a heart-lung machine to speed up recovery. These innovations are shaping the future of CAD treatment, making interventions more precise and less invasive. If you're interested in a specific treatment, let me know. Okay. Then we've got the latest treatments for coronary artery disease offer significant advantages over traditional methods, particularly in terms of precision recovery time and long-term effectiveness. Okay. Give me a second, guys. Okay. Composition of new versus traditional treatments. Aspect. Traditional treatments versus new treatments. Approach. Medication, lifestyle changes, bypass surgery, angioplasty, AI-assisted diagnostics, personalized medication, minimally invasive procedures. Effectiveness. effective for symptom management and prevention, more precise, tailored to individual risk factors, and often more effective in high risk patients. Okay, then you go down, we got recovery time, longer recovery time, especially after bypass surgery, faster recovery with techniques like off pump coronary bypass and endovascular thrombectomy. Give me 1 second, guys. I have to change paper. Okay, risk factors. Higher risk for complications from invasive procedures, reduced complications with AI-assisted clot detection, and mechanical coronary supports. Cost generally more affordable and widely available. Some newer treatments are expensive and not yet widely accessible. Okay, key takeaways are traditional treatments remain effective, especially for managing symptoms and preventing acute events. New treatments focus on precision medicine, AI-driven diagnostics, and minimally invasive techniques, leading to better outcomes for higher risk patients. Okay, cost and accessibility remain challenges for newer treatments, but they offer promising advancements in long-term survival and quality of life. Would you like to explore a specific treatment in more detail? Okay, guys, so that's C for you. I might jump back on later for D. I will let you guys know. For now, Gator Wellness. Take care, folks. I might be back on later for D. I will see you guys later. For now, Gator Wellness. Take care, folks.